The treatment of colon cancer really starts with evaluation in the office after it's discovered. Again, these are usually found during colonoscopy, occasionally actually found during the routine screening colonoscopies when the patients are having no complaints at all. Extensive testing is done before the surgery, CT scans, blood work, sometimes MRIs, to determine exactly what the staging of the tumor is before we do the surgery. So when we do the operation, not only are we removing the cancer, but we're removing what are called lymph nodes. You can always think of the colon simply as a hot dog, and there's a bunch of fatty tissue around it. It looks like a bun. And in that fatty tissue is a bunch of lymph nodes. So when we do the operation, it's very important that that fatty tissue be removed. That fatty tissue in the tumor is then given to the pathologist, and he finishes the staging procedure to see by looking at the tumor and looking at lymph nodes. Laparoscopic instruments are very straight instruments or look like two chopsticks you're operating with. And robotic surgery allows us to use wristed instruments. In other words, to use something very similar to the human hand. And this has had significant advantages to the patient because in parts of the abdomen where these cancers occur, there's great troubles with access. With the wristed instruments, it gives us more access. We can do things very much more in a similar fashion that we were doing with the human hand, and this allows us to complete many more operations through small incisions than big incisions. When we do robotic surgery, laparoscopic surgery, this has markedly improved the patient's recovery, and when they recover quicker, interestingly enough, they also have less complications. It was very common that patients would miss 4 to 6 weeks of work after one of our operations, and now they very commonly are back to work in 2 weeks. The Holy Cross Health System has been at the forefront of both laparoscopic surgery and robotic surgery as they have developed in this community. Holy Cross Hospital in Silver Spring was one of the first hospitals in the area to bring in robotic surgery. In addition to being in the forefront of bringing the initial technology in the community, the system continues to expand and bring in the newer versions of the robotic technology. The XI robot will expand our ability to treat even more difficult types of tumors. Well, the prevention of colon cancer is quite simple. Get your routine screening colonoscopy when you're 50 years of age. And if you have a family history of colon cancer, see your primary care doctor. Discuss this issue at a much earlier age. Some of these patients should have their screening exams performed at 40 or at latest 45 years of age. So get your screening colonoscopies, and that's the most important thing we have in prevention of colon cancer, technique we have in the prevention of colon cancer.